When I got into medical school, I actually thought I was going to be a pediatrician when I first started. But everyone kept on telling me when they would meet me, they'd look at me and they go, "You're going to be an orthopedic surgeon." And I kept on saying, "I'm not so sure about that." But then over the course of 4 years, I realized that's what I wanted to do. I like reconstruction, I think, more than any other aspect of hand surgery. So reconstruction could be anything from replacing a joint to fusing a joint, even taking it one step further, trauma, and how you can reconstruct something after it's been damaged and trying to make it workable. So I think I find that to be the most challenging and most rewarding when it works. Sometimes it doesn't, but again, you do your best. But I think I like that the most because it's thinking out of the box. When I was finishing up my fellowship in Indiana and I was looking to come back to the East Coast, I looked at a lot of different places. I didn't look just on the East Coast, actually. I looked in Texas and I looked in other places. And I realized after that search that this practice is unique on a lot of levels, not just the amount of or spectrum of care that you receive in terms of the different subspecialties, but it's a unique practice which is unlike other places, and I think a lot of that has to do with relationships between the partners. I think it's rare to find a group as big as this to be able to operate and get along as well as we do. Most patients realize that when they come here that they'll have a relationship with their physician, with their orthopedic surgeon, which is not what you're going to get in a lot of other places. So I think that's one of the things that we offer. Not, again, I can tell you all the other stuff, great care and all the other things, but at the end of the day, I think it's all about relationships. And I think we do a better job at establishing relationships with our patients so that they trust us and they want to come back to us because we know them as people, not just as patients.